Hello. One of the things I want to be able to talk to those folks of you that are either aging into Medicare, and if you're turning 65, I want to welcome you into the 65 Club. For those of you that are in the Medicare Club, is understanding how Medicare works. One of the things I take great pride in is helping my clients I work with navigate through and understand how Medicare works. One thing great about Medicare, it's a great health plan. It's how you use it and what your options are. The problem is, it's who you talk to that determines on what they feel is going to be the right product for you. One thing I say when it comes to healthcare at all, it doesn't matter about what somebody else has, because everybody has their own opinion of what they believe is the best product they have. It doesn't matter. The only thing that matters, what matters to you. So when it comes to Medicare, how are you going to use Medicare? Not only today, but where do you think your health is going to be in the future? As we get into our 60s and our 70s and our 80s, that's when things start to happen. Well, listen, I'm 72 years old, and I battled some of my old stuff, particularly getting up in the morning. But one of the things I find just simply going to the gym is be able to exercise. That's the key. It's all about mobility. The thing is, when it comes to really using the healthcare system, I always say, do you want to manage your own health care, or do you want the insurance company to manage your health care? Because I guarantee if you manage your health care, you have more choices versus the insurance company managing and determining whether or not they're going to approve that referral that's coming in for you to have a procedure done. Again, the choice is always to oneself. So it doesn't matter what someone else has. Well, also it matters what matters to you. My responsibility to the clients I work with is help them understand what their options are. It's not about selling them a product. It's about helping people make an informed decision. I do consider myself a health advocate. My responsibility is to help my clients navigate through our healthcare system. Understand what your options and choices are. Do you travel? Where do you travel? Do you travel outside the country? Do you take trips? Those are the things to understand that Medicare will cover some of it, but that's a reimbursement. It's whether or not you're going to be covered when you travel outside the country. Now, I do work with folks, they're patriots, they travel outside the country a lot, and their health plan is different. Why? Because again, they're traveling. So it's helping you understand what your options are. But it really comes down to where you live, where you want to be able to go. If you want the freedom to see any doctor that accepts Medicare, well, then that's a good, obvious choice of what you want to have. But do you have that choice? The thing is, I'm here to help you navigate through it and make an informed decision. So if you have a question, or even a question answers, I'm going to be able to provide that. My responsibility is to help you navigate through your healthcare system, because what's important to you is what's important to you, no one else.